Predictive analytics can be used to personalize healthcare for each patient. There is a major opioid crisis occurring throughout our country. The number of heroin-related deaths has rapidly increased in the past decade. As more people are using heroin, there are more people searching up data regarding their symptoms. We all know that we shouldn't Google our symptoms when we don't feel good, because either we find out we have some cancer or some rare disease. So what can we do to get more accurate results? There are many companies that collect our search history and are maybe even listening to us and use this data to place ads in our feeds. However, using predictive analytics, this data collected can be used to predict, for example, the following year's emergency department heroin-related admissions in cities with greater search history of heroin. Predictive analytics can be a highly cost-effective source for insights as they are freely and publicly available for research use and provide information on opioid-related psychology and search behaviors of individuals. In geographic regions or countries where no current heroin-related data exists, internet search might be a valuable tool in providing at least a first estimate for changing heroin use trends. Using the geolocation of search behaviors can offer more precise and targeted community-based opioid overdose education and distribution interventions to proactively target high-need areas. There are many pros to PA, however, I believe it removes the human aspect of the clinical setting. As a physician, it is the doctor's responsibility to make a relationship with the patient so that they can be more open and comfortable about their health concerns. It can also conflict with HIPAA as more companies get their hands on confidential patient information that should only be accessible by the patient's doctor. Using PA, there is a possibility that the trust between the doctor and patient can be lost.
Data mining has helped us lead to big data and predictive analytics in the clinical care system. Big data allows for electronic medical records, which allow physicians to store more information about a patient and to find information faster. Predictive analytics is the use of electronic algorithms to foretell a future clinical event. This can help clients make decisions ahead of time. It has proven itself to be successful, but there is also a big question of ethics. This is a similar problem with self-driving cars. Imagine this. There's a pedestrian crossing right in front of your self-driving car. There's a motorcycle to your left and a minivan to your right. There really isn't a way that you can avoid an accident. What should the self-driving car do? Should it run into the pedestrian, turn to hit one of the other vehicles? It's similar with predictive analytics in the clinical system. There are many different parties involved in the clinical setting. There are people who create the algorithms and those who are treating the patients. There could very well be a difference in concerns that can mess up the algorithm. For example, the physicians might want what's best for each patient. The business side might want what is going to cost the least amount of money. The programmers of the algorithm might just be given a task, but they might not understand the clinical side or the business side of things. These differences in values could cause ethnic issues. Should the PA recommend a surgical intervention, improve overall health of a population, reduce healthcare costs? Should the predictive analytics say to heal one person by giving surgical intervention, or is the condition so contagious or harmful that the person should be put down to improve the overall health of a population? The problem of ethics is not one that technology should be solving. I believe that predictive analytics should be used to aid clinicians, but it should not be depended on to make all the decisions.
The Nuremberg Code is a set of ethical principles for human research developed as a result of the cruel human experimentation conducted in World War II. It has had a dramatic influence over the conversation of ethics in research, particularly its first principle stating, the voluntary consent of the human subject is absolutely essential. Informed consent is now an internationally accepted standard for any human-based research. As progress continues to be made with predictive analytics, it is important to consider the informed consent. While it might be argued that users provide their consent while registering for online accounts, I think it would be difficult to make the case that this is informed consent. Most users do not read the agreements before accepting them. While this may be considered consent, it would not be informed consent. It is the responsibility of researchers to ensure participants of a study are informed before the start of the study, and the participants can withdraw consent at any point during the study. This is not an easy problem to address with the data of millions of people being collected for each study. While it may be tempting to ignore this problem, stating the fact that their data is being collected and used by private companies anyways, this is not a defense of the practice itself. We need to determine if the action itself is justified, which is independent of what others are already doing. The other tempting objections state that this research will save lives, so it must be done. However, traditional research can provide just as important breakthroughs, but still require informed consent. The argument of the greater good is not a compelling argument against consent. I don't know the answer to this problem, but I think it is important we continue searching for an answer. While we think of innovative ways to collect and use big data, we should equally be considering innovative ways to collect the informed consent of those producing the data.
Using informatics for healthcare is not necessarily a new idea. Implemented in the past, the usage of informatics for predicting epidemics has been relatively successful. A past paper has given some insight on how internet search histories are relevant to predicting opioid usage. By predicting hospitalization of heroin admissions, hospitals can improve the time and quality of their patient care. A model made from the study explains 72% of the variance regarding heroin-related ER visits. Using only internet search data such as Google Trends and other low-cost methods has helped improve patient care drastically. On a public health standpoint, healthcare informatics is an important weapon for improving primary prevention. The ability to target and predict when epidemics might occur is an important way to improve the overall healthcare of a population. However, the intrusion of privacy creates an ethical problem. The use of informatics already is and will be an even bigger ethical problem. Despite being such an ethical problem, most people are not concerned about it. In this digital age, people are already aware of how corporations use and collect their personal information. Constant reinforcement of this new age of data has desensitized people to the fears of losing private information. As healthcare informatics begins to build more traction, people begin to debate the legality of using informatics. But I believe that the industry will continue to grow stronger and bigger based on prior events of data mining.